Hello, a very good day to everyone. I'm Dr. Tanya, emergency physician from Hospital Tawau. Welcome to Basic Life Support for Healthcare Workers second edition. Okay, so these are our course content from objective to introduction to anatomy and physiology of cardiopulmonary system, overview of basic life support, AEDs, BLS during pandemic, and also summary. Okay, so by the end of this course, by right, you should be able to describe the links in the chain of the survival. Okay, so I'm telling you that the chain of survival is very, very important. And then you should be able to understand relevant anatomy and physiology of the CPR system, able to describe, understand, and also perform BLS during normal times and also during pandemic. Okay, so basically, basic life support includes when we talk about basic life support, it means other airway, breathing, circulation, and then AED, okay, and then how to manage choking and also foreign body area obstruction. So ABC, AED plus choking. Okay, this is a very important slide. Okay, so basically chain of survival here. Okay, you must remember each chain. Okay, each chain is very important. 1, 2, 3, 4 chain. The first chain starts with early access, followed by early CPR, early defib, early ALS, and post resuscitation care. Okay, so when you talk about early access means what? Somebody has collapsed and you recognize this is collapse, then that means early recognition of the collapse, and then you call for help. Okay, you call for help. That is what you call as early access. Okay, what do you do after you call for help? Then you start your CPR. So that's where you get early CPR to buy time. Early CPR. Okay, next would be early defibrillation. Okay, why early defib? So that you can jumpstart the heart. Okay, and then next will be early ALS and post resuscitation care. Okay, so again we repeat, first chain is early access, early CPR, early defib, and early ALS and post resuscitation care. Okay, what happens during sudden cardiac arrest? Okay, when there is a cardiac arrest, what happens? That means the heart actually stops beating. So what happens when heart stops beating? Then the blood doesn't flow. Blood doesn't flow to the vital organ like brain, heart, the kidneys. So they stop flowing. So when you don't treat the cardiac arrest within minutes, death will come lah. Okay, so what are the signs and symptoms of cardiac arrest? It's very important to know what are the signs and symptoms of cardiac arrest. First would be unresponsive. Patient tak sedarkan diri, dia unresponsive. When you check for breathing, okay, you call uncle, tak respond. Lepas tu you check for breathing. Is there any breathing? There is no breathing. Or the patient has the agonal breathing. Abnormal means like agonal breathing. Okay, so then no pulse and also no signs of life. Okay, so basically this graph is just telling you, okay, this is percentage of success versus time. Okay, so at 0 minute, first minute, if you start CPR, the percentage of success CPR is high. The longer time you take, the percentage of success menurun lah, reduces. Okay, so it's just telling you, if you want to CPR, you start early. Don't take long time to think whether you want to CPR or not, because as the longer time you take, the chances of successful survival rate is reduced. Okay, basically for cardiac anatomy, you need to know lah, the heart is made from muscles, right? Myocardial muscles, okay? So the muscles are the ones that helps it to contract and pump. And within the heart, there are four chambers, right? Either heart chamber, four chambers that they collect the blood and then allow for blood flow lah. So you have heart valves, which allows for one-way blood flow, other conduction system, the AV and the SA node, which helps the heart muscle to contract. And lastly, got the coronary blood vessels, which supply bloods to the heart. Okay, basically there are theories on how CPR works. Okay, basically you have the cardiac pump and also the thoracic pump. So how does the cardiac pump works? Basically, in cardiac pump is when you push, you buat CPR kan, you push down on the chest. The heart is squeezed between the sternum and the spine. So when you push down, you squeeze the heart and then the blood move out from the heart to the vital organs. Okay, so what about thoracic pump theory is when similarly when you push, okay, you push down on the chest, you get a positive intrathoracic pressure lah kan, so blood keluar kan from the heart. So when you release, okay, so you create a small negative intrathoracic pressure, and then that's where blood gets sucked back into the heart. Okay, so with continuous pushing down on the chest and releasing the thoracic pump theory ni, then you get what blood goes out and comes back to the heart, which means this is what maintains the blood flow and oxygen delivery to the vital organs. Okay. Okay. Basically, here we are telling you that in room air is a 21% oxygen that we are breathing. Okay. So when a patient collapse, when you give rescue breath, okay, when they collapse, they are not breathing. Okay, so they don't have that 21% oxygen at all unless you give that rescue breath to them and then they get their 16% oxygen. Okay, so we will go into BLS. Okay, so before we begin, just a little bit of terminology. So here when we speak about adults, we are talking about anything, any age group that is after the onset of puberty or after 12 years old. Okay, children would be 1 year to puberty or 12 years old, and infant is 1 month to 12 months old. Okay, 1 month to about 1 year old lah. Moving on, next would be the algorithm for adult basic life support for healthcare worker. As you can see here is the mnemonic that can help you to during your practice or exams, right? In between the session, let's say macam you forget kan, you can actually use the mnemonic here. You take a step, you stop for a while, take a step back, and then try to remember which step are you. It usually helps mnemonic. Okay, so you start with D for danger. Okay, as healthcare provider, I'm pretty sure that all of us are taught that you need to wear your PPEs lah, your apron, your gloves, your mask lah, whenever you you attend a patient. So the same goes, you want to make sure yourself you are well protected before you want to help others. Okay, apart from that, you want to look out for any blood spills, any sharps, okay, electrical wirings, okay, or example, patient fall in the toilet, it's very wet, slippery. Do you think that is a good place for you to do a CPR? And then subsequently when AD comes, you want to attach your defib? No, because it's very wet, very small space, very wet, very slippery. So you might want to bring the patient out from the toilet, put on the proper bed, or on the floor is okay, as long as it's dry and clean and flat surface. Then only you can say that it's safe. for yourself and the patient itself. Okay, after that you check for response. D, then kepada R. Okay, you check for response, tap on both shoulder. Hello, hello, are you okay? No response, what do you do? So you shout for help. Okay, you shout for help. If you're in the ward, tolong, tolong, ada patient collapse, bawakan resuscitation trolley and also the machine defib. Okay, if you are outside, hey you lady in the pink, can you help me? There's a patient collapse, can you help me call 999, get the ambulance and bring the AED machine. Okay, so after that, DRS, dah, and then you airway, open the airway. Okay, you perform head tilt chin lift. Okay, head tilt chin lift. Okay, open the airway. After that, for breathing, okay, here is very special, as in if you are a healthcare worker, you are a trained healthcare worker. Okay, here you look for breathing kan, look, listen, feel for 10 seconds kan, look, listen and feel, not more than 10 seconds lah. Kalau lebih daripada 10 seconds tak ada breathing lah. Okay, if you don't have breathing, then you start a chest compression. If you have agonal breathing, abnormal breathing, you start a chest compression. And here is very special, is because if you are a healthcare worker and you are trained, by right you should do your check for your breathing simultaneously dengan checking pulse. Check for look, listen, feel, and simultaneously your hand kena check for pulse. That we will be you will be teach lah during the practical session in detail. So if you are a healthcare worker, you should check for breathing plus check for pulse. Not more than 10 seconds. If no pulse, no breathing, then you start your chest compression. So your DRS AB next will be circulation, chest compression. Okay, so the chest compression, when we talk about chest compression, it has to be high quality chest compression. Regardless, during assessment, during exams, you will always be asked, what are the high quality of CPR? You need to know. Okay, so high quality CPR, you must have few components. Push hard, push fast. Okay, what is hard? Hard is the depth 5 to 6 centimeter. Push fast, how fast? 100 to 120 beats per minute. Okay, what ratio? 30 to 2. 30 compression to 2 ventilation ratio. Okay, with each ventilation in 1 second. Okay, so minimize interruption, complete chest recoil after each compression, and also location should be at the middle of chest and lower half of the sternum. Okay, can you remember that? If you can remember, so we try to recap together. Okay, push hard, how hard is it? Yes, 5 to 6 centimeter. Push fast, how fast is it? Okay, 100 to 120 beats. What is the compression to ventilation ratio? 30 compression to 2 ventilation ratio, with each ventilation kena over 1 second. Okay, lepas tu kena complete chest recoil, and then minimize interruption, and then location should be at the middle of chest and lower half of the sternum. Okay, so DRSAB. C, next will be D, defibrillation. Okay, once AED arrives, you have to attach your AED, and then if shock is advised, then you defib. No shock advised, then no shock advised, then continue your CPR, or the most important here is do not interrupt lah during the chest compression. Okay, so the next would be pediatric basic life support for healthcare worker. So here would be, if you look at the algorithm here, it's the same, DRS ABCD, kan? DRS ABCD, doctors ABCD is about the same sebenarnya. So danger still, you make sure you are protected, clear danger. After that, you check for response. No response, you shout for help. After that, you open the airway by performing head tilt, chin lift. Okay. So after head tilt, chin lift, after that you check for breathing. This is where it is a bit different. Okay. So you look, listen, and feel. Okay. For no more than 10 seconds, check for breathing. Here you don't do simultaneous. Like adult kind, we will do check for breathing and pulse simultaneously, right? So here we don't check pulse and breathing simultaneously. You check for breathing first in 10 seconds. If no breathing or agonal breathing or abnormal breathing, then you give 5 rescue breath. Okay. Pediatric is a bit special. You give 5 rescue breath first. Okay. Then after that, you check for circulation. Then after that only you check for pulse. Okay, you check for pulse. Okay, you check your pulse, and then for 10 seconds. Okay, if there is no pulse, or if the pulse is less than 60 beats per minute, with poor perfusion, then you can start chest compression. Okay, so the quality of CPR is the same. Push hard, push fast. Okay, how fast is fast? Okay, so later I will show you in the last slide. Then to show you what is the, to recap back in high quality chest compression for pediatric. They are a little bit different. Okay, so we will look into that in the last slide. Okay, so you try to remember this for pediatric. Is a little bit different for breathing. Check for breathing. If no breathing, give 5 rescue breath. After that, you check for pulse. If no pulse, or there are no or the pulse rate is less than 60 beats per minute, then you start your chest compression. Okay, after that, doctors A, B, C, D. If D here, you once a defib machine arrive or AED arrive, then you put on your pads and then follow the AED advice. If they say shock, then you shock the patient. Okay, if no shock advice, then either you can immediately continue CPR, or wait lah until the next prompt. Okay. Next up would be okay, foreign body and airway obstruction. Okay, this is a very important slide. Okay, generally you need to know what are the general signs of foreign body airway obstruction. Okay, so how do you know this is foreign body airway obstruction? Means choking lah. How do you know this is choking? So first, it has to be witness. Okay, it must be a witness episode of choking. So then it should be sudden onset. It should be sudden onset lah. Okay, and then patient can start coughing. Start coughing, batuk tak berhenti, and then got choking sensation. And then there are significant history of playing with small object or eating small object. Okay, so in generally you need to know how is the sign for mild foreign body area obstruction and severe. Mild choking dengan severe choking. What happens in mild choking? People with mild choking means you're in your area ni only partially obstructed. So mild choking ni is how do they look like? So basically, they can still respond to your, when you ask them question, they can still respond to you. Okay, or they cry. Okay, then they will have very loud cough. They can still breathe. Okay, there are no cyanosis, and they actually literally they can respond to you. Okay, so what happens to those with severe? With severe, that means it's fully obstructed. So when it's fully obstructed, means they cannot talk, cannot verbalize. There can be silent cough. They cannot breathe properly. They might look sinus sebab dah block kan the airway. So look sinuses, or they unconscious, decreased level of consciousness. So you really need to know what are the general signs, what are the mild signs, and what are the severe signs of choking. This is a very important slide, okay? So for adult foreign body area obstruction, adult choking adult choking. So you have to divide into mild and severe. Okay, in mild choking, patient can still cough. So what you can do is we encourage the patient to cough. Okay, we encourage the patient to cough until the obstruction dah relief. If in severe obstruction kan, severe choking, if patient is conscious, then you give 5 back blow and 5 abdominal thrust, which we will teach you in detail during the practical time. Okay, if unconscious, then you just start CPR. What about pediatric then? Okay, so for pediatric, it's the same. For mild choking, you just encourage cough basically until the obstruction is fully relieved. So for severe type of choking, so you need to see whether it's unconscious or conscious. If conscious, you give 5 back blow and 5 abdominal thrust. But for infant, you change to chest thrust. Okay, you use chest thrust. Okay, so basically if unconscious, you just start CPR. Okay, so next up would be regarding AED. Okay, AED is if you, I'm not sure if you have seen AED before or not, but basically it's battery operated, it's portable. Okay, so it is very smart, because when you put the pads, connect it to the AED, they can analyze and decide whether this patient requires defibrillation or not. Okay, what does defib basically means? Defib basically just means that they restart the heart. They recognize there is some shockable rhythm, then they give some DC shock to the patient, so that they can jumpstart the heart basically. Okay, so as you can see, these are the conventional AEDs that you can see in the market. Does AED exist in ward? The answer is yes. Okay, so basically in every ward there is a defib machine, and in all the defib machine there is it is fixed with it comes with an AED function. If you realize that the defib machine, the basically most of the ward, they have a biphasic defibrillator. Okay, all this defibrillator comes with an AED function. You will see AED at the tombol at the knob there. Okay, you just have to turn your knob to the AED function. Just that for that function to work, you need to have pads. So pads like this, so that is attached so far most of the ward they use paddle, they do not have an attached pad. So you need your ward, the sister penyelia have to buy request to buy these pads so that you can connect to the defibrillator machine, and then when you turn on the AED function, it actually functions like an AED. Okay, so here what we want to tell you that is that if you only CPR, remember the chain of survival. First you have early access, right? Remember the chain of survival, the first slide. Okay, the first is early access, then early CPR, early defibrillation, early ALS, and post-discharge care kan. So your early CPR and early defib. So here, remember the chain, you need to go up to the defibrillation if you want to survive Basically, if you CPR the patient, you only CPR, you don't, there's no defib, only CPR CPR and CPR only. So basically, they are telling you the chances of survival is only 3 to 5%. But once you have the AED machine comes by, then the survival rate actually increase up to 70%. So that's why the new addition of basic life support, they really put a lot of emphasis on AED, okay, defibrillation for the patient, okay. So AED basically, like I say lah, it is user friendly. It is a voice prompt, auto method. It is as easy as 1 2 3. By right, everybody can use it. Okay. Next we move to BRS during pandemic. Okay. Of course, COVID-19 era is no more lah. It's no more here, but we are always under the threat. In Tawau, we are always under the threat of what respiratory cases that we always have to be on alert of. TB cases, right? Yeah, so this is very important for those in the respiratory ward or dealing with TB patients, okay? So if you look at the algorithm, it's still the same DRS, A, B, C, D. But what is different here? Basically, DRS is the same, danger response shout, is the same until to airway and breathing. Okay, in airway, you do not have to open the airway. Okay, you do not do head tilt chin lift. You just cover the victim face. This is if you are outside lah. But if you are in hospital, by right, you should just give a face mask lah. You should give oxygen to the patient. Face mask 6 liters per minute. Okay, airway, breathing. You do not have to do look, listen, feel. Dah lah got TB, and then you want to go and look, listen, feel very near to the face. Memang you mengundang lah nak dapat TB tu. Okay, so take care. Okay, for that. And then next is airway, breathing, circulation. Here, circulation you can do in 3 methods. Okay, so the first method is the standard method lah. You start your chest compression, and then another person should start your back valve mask with a filter and a very tight seal. Okay, then you can do your 30 compression to ventilation ratio. Make sure BVM with a filter and a very tight seal. Okay, or number 2, you can do your continuous chest compression and then you put a face mask 6 liters per minute. Number 2, or number 3, continuous chest compression with the victim's face covered. But that is if you are outside lah. Okay, when you don't have oxygen, you just cover the face so that when you do chest compression, the respiratory droplet, the TB droplets don't fly out lah. Okay, next is when the defib machine comes, then you just follow the AED prompt, whether there is shock advice or no shock advice lah. Okay, so what is the important here is if the patient has a DNR order, then you don't do the CPR for the patient. Okay, you must wear PPE. Okay, wear your N95. Okay, no need to open airway, no need to do look, listen, feel for breathing. Do not do mouth to mouth or pocket mask ventilation. Okay, don't do that lah. Okay, just cover the face lah. And then if you are using a BVM, back valve mask, make sure it has a filter and it is very tightly sealed. Okay, and next you can cover the victim's face using a cloth, plastic, or a face mask during the CPR. If you are in a district or like kecemasan, it's preferably you use a supraglottic airway device lah. Example is LMA if you have it. And then if for CPR wise, if you have a mechanical CPR, it's preferably to use it. Next would be if the patient have pulse but there is no normal breathing, then you can give a rescue breath with your back valve mask with filter and a tight seal. You can give every 5 to 6 seconds one breath. Okay, so do remember this lah. The most important caveat here I think would be no opening airway and do not do look, listen, feel. Okay, BVM use it with filter and very tight seal. Okay, so these are the summary of steps for BLS for adults, pediatrics and infants. Okay, so these are the most important slides of all when you try to revise. You should have a look of this table. So basically this is the steps, BLS steps for adults, pediatrics and infants. Okay, basically all their sequence are doctors ABCD. Okay, so what is their compression rate? Push fast, all are 100 to 120 beats per minute. Okay, but push hard here, there is different. For adult is 5 to 6 centimeter, pediatric is 5 centimeter, infant is 4 centimeter. But if you cannot remember 5 centimeter, 4 centimeter, then you remember at least 1/3 depth of the chest, 1/3 of the anterior posterior, 1/3 of the anterior posterior of the chest. Okay, 1/3 daripada kedalaman dada. Okay, ataupun 5 cm or 4 cm. Okay, the both also minimize interaction, allow complete chest recoil kan. So compression ventilation ratio, if you look at this, it's very different. For adult is 30 breath and 30 compression and 2 ventilation ratio, but for pediatrics as 15 compression and 2 ventilation ratio. Both pediatric infant, so a bit different, right? Adult 32, pediatric infant 15 2. Okay, so for adult, those already intubated with LMA or also advanced airway, then you can give 1 breath every 6 seconds. For a pediatric infant, 1 breath every 2 to 3 seconds. Okay, so all three require AED lah, as soon as available. And so these are the references, and also the committee for the National Committee for the Basic Life Support. Okay, so with that I thank you. So if there's any question that you cannot understand, and do not worry, during the practical session try to ask a lot. We will try our best to help. Okay, so all the best. May everyone who join our BLS pass. Okay, thank you very much.